Like, do you need to examine a patient in order to do a mammogram that's a screening mammogram, or like fecal occult testing or diabetes checkup with a hemoglobin A1C from venipuncture? Do you need to have them in person to give them that requisition? The answer is no, you don't. DEXA scan. Things are classical. Pneumonia vaccine, hepatitis B vaccination. These are classical things that you don't like. We could automate that to make it efficiently. And then you have the AI going like, this is how you should bill it, get your revenue, and then could eventually do that. Today at 7/20/20, July 20th, 2025, I saw John Doe at 15:42. Billing codes are this, screening this. I will make $40, $50. I don't know how much you make, for example. Requisition sent over to the patient. We're pending revision of the results and discuss it over with them. Okay. Receive payments 25% faster with AI. Sends claims error-free. So reducing unnecessary care, imaging reduction, AI care cuts unnecessary imaging by about 24%, ER optimization. This is so this depends of the tools. It's kind of a wide statement. ER optimization, automated triage, reduced emergency load by about 19%. This is where I'm trying to get instant HPI to people here in Quebec, and it's very difficult because the system is very fractioned, and the people at the head, at the top, they have understanding of what needs to be done, but they're not even doctors, number one. Our health minister is an accountant, the health minister. So they're used to numbers and they don't know, they don't have experience as far as like, what do we need to do? What do we need to optimize? They know, well, we should optimize things with AI. They just don't know what. So this is where you already know your job as a physician, what you ought to do. You know where this requires energy and you have experience to some degree. But automation and AI implementation has to be done by physicians. It doesn't make sense otherwise. They have to hire somebody that knows what the hell they're doing. So we already have studies in similar type settings that automated triage reduce emergency room load by 19%. When I wrote to the government, I told them, this is the following thing that you should do. We have services like Info Santé 811 in Quebec. So these are triage systems. People call over the phone. They say, I don't have a doctor. I need to be seen. I feel sick. These are my symptoms. This has to, instead of going directly to a nurse that just talks to the patient, it has to go through an AI filtering process like instant HPI. The patient fills in the form sends it over to the nurse. Now, the nurse has all the information organized and triaged by the AI. The AI says, well, this is a patient that passed out. This is triage, what we call here P1. This needs to be seen in the emergency department because we don't know what it is. Could have stroked out, could have been orthostatic hypotension, like a vasovagal episode. It could be something far more serious, right? It could have been a epileptic seizure. Who knows? So this is already arranged by instant HPI for the actual nurse. And the nurse then even has a referral to the ED physician that she could send to the patient, explaining the entire process of all the information that was captured so that the physician doesn't have to do it again or the nurse at the hospital do it again. This can all be done online. This would significantly decrease because the other problems here in Quebec is, let's say the patients so they don't have a family doctor, they get sick. They go to that nurse and then she goes like, well, I can have you seen tomorrow because this is different. You have like a dental infection. The AI says you could use Advil and have him seen by a dentist tomorrow, or it can be seen irreversible pulpitis, whatever diagnosis the AI thinks you have, dental cavities, dental fracture, who knows, right? The AI will prepare a document that can then be provided to the next person taking care of the patient in a streamlined fashion. So this, I recommend it to the government here to put it in the DSQ, which is the online medical record for all patients, so that it's accessible to doctors in the emergency department and the patient doesn't have to bring a paper that he printed. If it's done at the level of the Info Santé, it could be recorded directly in what already exists as a communication tool that's available to all physicians, nurses, and everyone else, including the patient. It would be even more transparent, very reliable. It's already perfectly secure. It's how the government communicates imaging results, lab results to patients, gives them their vaccination history and their medication list. This is how every person in Quebec has access to that. So this should be the new standard for consultation in Quebec. It's not to call 811. It's for all these people that don't have a family doctor. They should fill this form online, and this will streamline a lot of the work that's going to be done at that point by the AI. Is going to be available for all doctors, including the doctors that will ensure the follow-up after the patient has left the emergency department. How do you communicate that to people that have no clue what the hell I'm talking about? You're a doctor, you're hearing this, you're going like, it's impossible. And that's where we are. So this is my new challenge and my new fight. It's getting this to the people that are involved in making these decisions, hopefully that we will ultimately get a more streamlined and efficient tool for the practice of medicine and providing care to the population here in Quebec.